Right. It's a little bit after 3 o'clock. We've got a good group. Nice to see you all. And for October Learning Collaborative, I'm super excited to turn it over to Ramona Bias. I think some of you, all of you, maybe you've had a chance to connect with Ramona. She has been with the System of Care Advisory Council since July, working with us as a fellow out of Portland State University Hatfield Fellowship Program, and has been full-time digging into the issue of respite in Oregon. So super excited for you to hear a little bit about the awesome work that she's been doing so far to understand the system or lack thereof, and use the time today to get your feedback and your thoughts about what this all means for the system of care and for kids and family in Oregon. So Ramona, I'm going to turn it over to you to get us started.
Great.
Chrissy, I'm sorry, your hair is amazing. It just came into view. I love it. Great, thank you. Okay, sorry, Ramona. I got it.
No worries. All right. Hi, I'm Ramona. I've met some of you. I am going to share a PowerPoint today. But while that's getting set up, in the introductions in the chat, if you want to do, okay, one sec, actually. There we go. Okay. Perfect. Okay, so in the chat, if you all want to do your name, pronouns, organization, and community, and then also look at what respite looks, or talk about what respite looks like to you, and also how you would define respite. And if it's like you don't know, that's totally fine too. Just whatever and anything you want to provide. Okay. Like we've got some really great definitions. Seeing a lot of like break as the definition, and that's kind of similar. A lot of words like relief, stress, pull situations, intentional, all those kind of things. So yeah, feel free to keep putting in the chat, but I'm going to get into kind of an overview of what respite is like, has historically been in the state of Oregon for youth 0 to 25, and also for like what it's kind of going to look like, or what it looks like right now. So looking at the history, so there have been a lot. Respite has been a barrier in the state for a while, the lack of respite for youth. And so there's been 3 formal barriers that have been submitted to the statewide System of Care Advisory Council from various systems of care around the state. So in June 2020, Lane County submitted a barrier that was saying there's a lack of sufficient respite care systems. In Central Oregon, they submitted one in March of this year that is an increasing need for respite services for youth and family, especially youth not involved in ODHS cases. So youth outside of the child welfare human services system. And then with the Douglas County, that was just elevated in July, and that is the lack of respite for youth, specifically ages 8 to 12, and also a lack of access to facilities that could support youth with behavioral health and mental health struggles. And previously in this last year, the Oregon Health Authority Health Systems Division put in a policy option package it ended up failing, but it was meant to increase crisis and planned respite for both adults and for youth. And it also sought to amend Oregon's Medicaid state plan to include access to respite care for children, families, and youth. And the package would have the pricing for the package was around $7.7 million and would have included 1.5 full-time staff. And youth respite would be implemented by the policy option package through CCOs and through community-based organizations by demonstration sites. And there was also a policy option package that passed that was submitted by the DHS Child Welfare, which is respite for resource families or foster families in the state. And so in 2021, the foster care program received a policy option package from the Oregon legislature to support a statewide respite care program. And this was implemented statewide, or there's a statewide respite and certification program implemented this year in January to help support resource parents. And they're currently developing a certified respite program to assist families of origin once reunification has been initiated or has happened. So yeah, so there is some movement happening at both like statewide levels and local levels, but it still has not been enough that it's like a statewide open access for everyone who needs respite for you. So going into what like respite looks like right now, I've been doing a lot of research into different systems around the state, like what that looks like, and we've kind of put things into two categories. There is home-based supports, which is people who open up their homes and have youth come into the home and stay for a weekend or a few days or whatever that would look like. And with that, also there's also in-home supports as well, having someone come to the home and take care of children. This is usually what people think of when they think of respite, kids going somewhere else or having someone come and like watch them like a childcare type thing. Then there's also respite centers and lodges, which are kind of the more facility-based, not necessarily more like sterile, but like they can be in like stabilization centers or provided by local like hospital systems and stuff like that. And then there are certified respite providers through DHS, which are the people that I just talked about in the 2021 POP, which was family or resource parents who can provide respite to other resource families for the weekend or for a few days if the family needs a break. And then within the intellectual and developmental disabilities realm, they have these programs called host homes, which are similar to resource homes, but for children who have identified intellectual or developmental disabilities, and it's in their treatment plan. And then with informal respite support, so those were the formal respite supports that we kind of have seen here in Oregon when it comes to youth. And then with informal respite supports, these are much more flexible community-based supports. So we have like relief nurseries. Most communities have a relief nursery, but those only serve children 0 to 5. We also have drop-in centers, which are run by organizations like Youth Era or by local community mental health programs. And those are, yeah, mostly for older kids, like 11 to 17, for them to kind of drop in and hang out. But there are some barriers with that as well, including like transportation, and they don't do overnight care usually. And there are after school weekend summer programs, which are pretty self-explanatory, but breaks for kids, getting them out of the house, getting them doing activities. And a lot of times those are school sponsored or like boys and girls clubs or things like that. There are parents' nights out, which are usually sponsored by child serving organizations, and they are kind of, as it sounds like, you drop your kids off for a few hours, parents get a break and go run errands or have a date night or whatever. And then there are faith-based programming and providers. So this would be both like kind of parents' night out model, but also organizations like Safe Families for Children, which take kids into their homes for extended periods. But a lot of those programs aren't necessarily made to deal with kids that have acute behaviors and big behaviors. And so they are not as, that's why they're not formal respite systems. And a lot of times are for people within their faith community already. And then there was also traditional childcare, which a lot of places are childcare deserts, and a lot of childcare services don't take kids with big behaviors. And then there's informal respite networks among families. So sometimes resource families or families within the IDD system will offer to like watch each other's kids for a weekend and then do the same the next weekend. So that is kind of what I've found. And Haley, if you want to talk about a little bit what Lane County is doing, they have a pilot program that is doing some really cool respite work.
Yeah, sure. Thanks, Ramona. Hi, friends. I think a lot of you, we've talked just because I've been pretty stoked and also picked your brains about respite in your areas, though not to the incredible degree Ramona has done. So shout out to Ramona. So here in Lane County, and this was before my time, but with the current biennium grants that we're all kind of within right now, my predecessor and our SOC members elected our barrier to focus grant funding around to be respite. And so, sorry, an email popped up and I'm like a squirrel. And so it was decided that our grant was going to focus on not necessarily implementing a brand new respite related program, especially not one around crisis respite, as we do have access to crisis respite in our area, although it's definitely not enough and it's not spread across the kind of age continuum. Like specifically the 6 to 11 population in our area does not have any respite supports, both formal or informal, other than maybe traditional childcare. And so our grant was going to focus on what would it look like to try to implement an evidence-based model. And so part of our grant hired a researcher, a retired University of Oregon anthropologist who specializes in research around children and families. And spoiler alert, the research did not yield any type of evidence-based models, because specifically research around what we're talking about here, right? So children and youth who are kind of multi-system involved, and especially with the behavioral health component, it just doesn't exist. It's relatively new to talk about respite for this demographic. And so we had to pivot from plans of hoping to have a model and maybe be able to pay for that model and implement it, help an agency implement it here locally. We had to pivot. And so we wanted to work with folks who either do some version of respite or already, or have done so in the past. And so we put a call out to those agencies that were identified through our system of care members, and the ARC responded. And our local ARC here in Lane County has a longstanding history of being very, very involved, but traditionally more so with the intellectual and developmental disability population. But through conversations and getting to know each other, we realized that there's really more of an overlap, and just one that they necessarily haven't called out before because the need hasn't been there, but that they're serving children with complex behavioral health needs as well. And that was kind of important to our system of care, that we focus in on specifically that demographic, right? So you'll see in your invite that there are your invite to this meeting, I should say, that there are two flyers for the programming that we're doing with the ARC. So Twice a month, the ARC is going to offer for up to 30 children and their siblings, ages 5 and up. They're offering 2 different opportunities. So one is a Kids Saturday Social, 4th Saturday of every month from 10 a.m. to 2 p.m. And that's just going to be a lot of fun. We have a really beautiful park that the ARC has built and still has more to build, and it accommodates children of all sorts of abilities. And so they're going to do a lot of things there. They're going to pay for lunch, and it's 10 a.m. to 2 p.m. one Saturday a month. And then the second Friday of every month is a parents' night out, 6 to 9 p.m. It's at one of their facilities, and it's the same thing. They'll provide dinner. They have more than enough qualified staff who can be present for these events and who specialize in catering towards children with multiple abilities, including those with some like medical complexities as well, which was another area that we were shown that there are just not a lot of supports out there. Because if you think about traditional kind of respite opportunities for children and youth, even something as simple as a day camp, which of course that comes with a certain privilege of being able to afford, but there are not necessarily day camp offerings for children who utilize like multiple assisted technology. So that's the plan with the ARC right now. And I do want to call out that we were going to be working with another agency to enact another form of respite that I think is brilliant, but unfortunately they realized that capacity-wise, this just wasn't the year for them. But I had never thought about, and I think several of us have never thought about, what about for children who have complex needs and when school is closed and their parents need to work, right? Like, yeah, a babysitter or a caregiver, but we know how difficult that is even in a more formal way in which people are in need of personal support workers or direct service professionals. And so this other agency was actually going to offer basically a day camp on all of the closed days that schools are closed, and also through some of like the winter break and things like that. So it's this genius model, and one that we weren't able to do this year, but it's another one of just informal supports. And then lastly, just to mention that something else that was looked at and ultimately decided like, let's put it on hold until we get this current project off the ground, was what would it look like to basically have a fund that community members could tap into for any of their respite or childcare related needs, right? Like it couldn't be anything like paying somebody's childcare fees every month or anything like that, but what would it look like to be able to support somebody who needs to be able to pay for a caregiver or even a babysitter, or to pay for a special day camp or anything like that. So just another idea for an informal respite support that we're kind of looking at in hopes that we in Lane County can have a menu of respite services that ranges from that kind of more formal that Ramona has identified here to the informal ones. I think that's all, unless there are questions.
Awesome. Thank you so much, Haley. I am actually going to pause right now. I know that was a lot of information for both me and from Haley. If there's any questions about any of the things that have been shared already, if people just want to unmute themselves or raise their hands, I'm going to stop the share so I can see you all. And yeah, feel free to just ask any questions. If there's not any, we will move along.
Ramona, one of the things that seems important, and Haley, I love that you spoke of kids with disabilities and that that's a population to look out for. I think in addition to addressing ability, respite also needs to address acuity, because some of the families who need respite the most have kids with really high acuity behaviors, and those are they're very difficult to find a break for.
Absolutely. And that's kind of why one of the things we're kind of looking at, like ultimately I'm forming policy recommendations related to respite, and we're kind of looking at like a menu of options. And so it's like families don't just have one option. Like if their kids have more acute needs, like they are able to get different types of care than families that have lower acuity children. But I think that's something really important, is to have this huge, like wide array of options for families. And yeah, Carissa.
Yeah, hi. So I'm coming with the perspective of a family member. And I don't know if this, I was like, I don't think this was in the slides. And so I'm just something I'm wondering about. And, you know, understanding these are children with higher acute needs. But what about tapping into family members that are, you know, I just think that's an untapped resource that not only supports staying connected with their family, but yeah.
Yeah, that's something that is happening a lot in the child welfare system and also the IDD system, where it's kind of so the it's hard because it's not like a formal support in the way that like these family members are like getting paid by like Medicaid reimbursed, but it is a lot of times families are up to find like it's up to them to find like natural supports. We're calling them like family members or like friends or people in their communities to care for the children. But that is has its own barriers because it is a lot of times like these families, if they don't have a support network or if they don't, the families aren't like financially able to get like compensated for their work. And so that is something that we are also looking at if that's something that can be built out bigger. But yeah, but that's definitely something that is existing right now and happening. It's just less documented as well because it's more, oh, will you watch my kids this weekend kind of works. So, but yeah, really good
Yeah.
point.
Well, as far as I know, and I haven't done this yet, but that, you know, like if the family member is taking the youth for the weekend or whatever, or even if it's just for the day, or that there's funding for those activities at least. I mean, I understand like person's not paid, that's fine, but even just having those funds to cover the activity, maybe the food or whatever it is, that can help offset that if they do have that support. And just another mention is just from, again, my own lived experience with my situation with my nephew. He has, the previous family, he just went to a different family now, but my mother, so his grandmother was able to take him, you know, they kind of agreed upon it with the foster family that my mother would take him like at least once a month. And so I just think that's something that is an option.
Yeah, absolutely. And I think that is something that's really needed. And yeah, I know some systems of care and CCOs are using some of their like flex funding and things to give like gift cards to people that watch the kid for a night to take the kid out to pizza or something like that. But I think it's not a super like elevated thing, and there are very like limits on how that money can be given. So yeah. Haley.
Yeah, sorry. I definitely have two more comments, but I just want to appreciate Carissa's idea. And also thank you, Carissa, so much for being here and speaking to your lived experience, which is what guides what we're doing here, right? So to what Carol said about acuity, I was personally worried about that. And so was my team, specifically with working with the ARC. And so I'm happy to report that that was one of the questions that we originally asked them was, is there like a certain guidelines for acuity in which you wouldn't let somebody in the door? And they said no. And so their registration form doesn't speak to a diagnosis. It doesn't speak to, do they have a therapist? It more talks about what are the strengths of your child and what helps your child, like what supports would they need from us. They're also allowing like parents to stick around or stick close, or caregivers. I just was really impressed. I think our biggest fear is the number one, like not having enough of them to go around, like they're having a big wait list, which in a way would be great because then that would be like, hey, next grant, we know what we're going to try to do, right? And that's, you know, definitely one concern. But then we're also concerns that just other barriers are going to get in the way, right? Like transportation, getting to Springfield. We're a really big county. We spread this far and wide. It's not going to make sense for one of our coastal towns to bring folks over here. So just equitably being able to have something like this in such a wide county. And I know so many of you understand that. So I wanted to speak to that. And then just very quickly for Carissa and that conversation, one of the concerns, or it wasn't a concern from us, so to say, but it was one of the barriers that stood in the way from one of our agencies interested in doing this respite related work, from having that fund that I spoke to about just being able to pay caregivers was just some of the bureaucracy that exists within an agency and not necessarily being able to do a check or a payment to an individual for something like this. And so I think that's just another like unintentional obstacle that stands in the way from us being able to offer that like flexible menu of respite related services. I certainly hope we can overcome that so that we can offer more opportunities.
Haley, that, yeah, absolutely to all of that. Another thing is bring up that there is a lot of people want to do respite, family members, CCOs, system of care coordinators, like all of the people that are involved in these systems do want respite, but a lot of it is also related to the workforce shortage among providers and like of space issues and all these like kind of like red tape things that get in the way of actually providing care. So that is another thing that is a barrier statewide for a lot of respite as well. So I am gonna go back and start sharing my screen again and okay. And so looking at, we're gonna do some breakouts now, where we're gonna have it be focused around both a definition of respite that we are kind of working with as a draft for the system of care, and then also looking at a mind map that we made through Miro, which is a software organization of kind of respite existence in Oregon as it stands right now. So getting into, and so we're going to break out and have people kind of just talk about that in their groups for a bit, but getting into what the draft definition that we're working with right now in the system of care is that respite services provide a break for primary caregivers of children and youth with complex behavioral health conditions. Effective respite services are culturally responsive, flexible, and provide a range of options from drop-in childcare like relief nurseries to overnight crisis respite services. So that's kind of the definition we're using, but other systems within the state have other definitions. So the child welfare, this is the national definition on the Department of Human Services like federal page, but it's that respite for within child welfare, a certified respite provider is trained to provide temporary care and supervision of children and youth in foster care. Respite care can be pre-planned or provided as a crisis support for resource families. And then within IDD, a lot of times like overnight respite is through host homes. So host homes are family homes in the community that serve 1 or 2 children with intellectual and developmental disabilities. Host home families provide 24-hour care to maintain a child's health and safety. Host home families also help the child gain skills, meet their goals, and support the child's family connections. Host homes are licensed and receive training, staffing support, and guidance from an endorsed provider agency. So those are kind of the definitions that we're working with, but the draft definition is, it obviously is going to be tweaked for as we keep moving, but we would love for some opinions on that. And then we also have, I'm actually going to stop sharing so we can pull this up. Christy and I came up with a mind map for respite work. And so, oh my God, one sec, okay, there we go. My screen got frozen for a second, sorry. And so this, I'm going to share it with you, and there should have been a PDF sent in the email to all of you. We also have a link to do for remote or for like you only as well. But this is kind of, it's a big mess right now, but this is what we are kind of looking at. So on the left side of the screen is going to be the informal supports that I talked about. So if we zoom in, we can see we kind of connected with like different organizations that are providing these types of programming. So like drop-in centers, we have Youth Era, we have YCAP, we have Youth Rising, and different CMHP run drop-in centers. And we have, Parents Night Out, Oregon Family Support Network. We have various relief nurseries around the state. And then over here, we have the more formal supports. So we have through Medicaid, what Medicaid pay for, through CCO specifically. These are the CCOs, just a list of them. And these are options that we're kind of looking at. We've been really looking at different funding mechanisms for what respite could look like. And so like fee for service, which is not currently an option in the state to pay for respite. CCOs, which are able to, in lieu of services, is another option that we're kind of exploring. Health-related services is another option we're exploring. And then there's also adult peer respite, which is being funded through the state's general fund. And we actually have a meeting set up with them to kind of talk about what they're doing, if that could be a possible option for that as well. Child welfare respite, IDD respite, Oregon Youth Authority, we're still figuring out what that looks like. And then these are down here are the kind of certified respite providers that are contracted with various CCOs around the state. So all of these kind of wild lines that are colorful and going, all kind of just are saying like who connects to who. So like Rainbow Lodge will work with both Yam Hill and Pacific Source Marion Polk. Rainbow Lodge is the respite provider. And yeah, then we're also looking into what the tribes around the state are also doing in terms of respite, and have some meetings set up with that as well. Yeah, so this is it's kind of funky, but this is what we're working with. I think we're gonna get into breakout groups. I'm gonna go, big screen again. Can you guys see the PowerPoint again? I just dragged it over. Okay, perfect. So we're gonna get into breakouts, and so we'll put all the definitions in the chat. But react to like the definitions and like what elements do you want to see reflected in a system of care definition of respite, like what's missing, I guess. And then also looking at that PDF or link of the mind map, looking at if we have missed any respite services or supports from your community. Within each breakout group, if you could assign a note taker, and then also assign someone to report out. We're gonna have a share out session after the breakouts, and if the person who took notes would be able to email that to me, so we can kind of just have a record of what was talked about. If it doesn't all get shared, that would be great as well. So Christy, if you want to facilitate the breakout.
Yeah, I've got breakouts ready. I just maybe
Okay.
pause to see if anybody's got any questions.
Yes. Yeah.
Before we move
No,
you
I know,
all
I'm
into the
just
room, and
fast.
you all look at each other and you say, what are we supposed to do? But you can always call us in or come back out. We're here to help you. But are there any questions before we zoom you off to a breakout space to dig into the definitions and the mind map? Okay. Not seeing any. So we will send you off. I think maybe how long are we going to be in those rooms, Ramona?
We
Till
are
about
going to be in there
4?
for, till around 4, about like a half hour-ish about. So.
Okay. All right. Here you go, everybody. I will keep an eye. If your room is looking small, I might zoom you off to a different room. So apologies in advance if that happens.
So some folks rolling from their rooms, but welcome back, everyone. I hope those conversations were okay. Yeah, so I'm going to share my screen again, and I think we have 6 breakout rooms. So if people want to just start sharing, I guess breakout whatever one. And if no one wants to speak up, I can just call on the representative from breakout room 1, 2, and 3, and 4.
Yeah.
But yeah.
Group 1 was Carol, Heather, Krista, and Sean.
So I can be the one to speak to, I guess, since I have it written down. And then Ramona, can you put your email address in the chat?
Mhm. Yes, absolutely.
Thank you. Our group talked a lot about the word crisis, well, the wording used in the definition, and the first one was the word crisis that shouldn't be part of the definition because successful respite averts crisis. And so that thinking of this more as a crisis service package without the word in the definition. And then also defining respite as it stands, it's defined as a break for the caregiver from the youth, but could also be defined reciprocally where the youth has a break from the caregiver. So maybe use the word and in that definition instead of to show both those things. We're supposed to say 3 things. Let's see. We also wondered how specific the definition needed to be. So should it mention children with complex needs? Does it need to do that? Is it an open definition, a working definition, or one that could potentially be put into legislation? How specific does it need to be to the population? Those were our 3 big things.
Awesome. Yeah, those are all really good points, and we will definitely take a look at that. Yeah, definitely having it be the break for families and for kids also is really important to like include, because it does, like, yeah, families get breaks, but kids also get breaks when respite happens.
Did you all have any comments on the Miro map? Are there any missing respite services that we should add?
I think we got overwhelmed by that map.
Fair enough. It is overwhelming.
It's a lot. But yeah, and feel free to look at that again too, or share it with anyone in your organizations and stuff. But yeah, I made it and I get overwhelmed looking at it, and yeah. All right, room 2, Christy, I don't know who was in that one.
Yeah, Christiana, David, and Jennifer.
Yeah, this is David. I don't know if I was appointed or not, unless Christiana wants to speak, but I would say in terms of definition, we had the same feedback that the respite could be bi-directional, and involve siblings as well, and just to account for that. And I think we got a little overwhelmed that some of the definition is very aspirational in nature, which is great, but it doesn't necessarily help us so much in terms of sort of a boots on the ground, looking at what's step 1, what's step 2, what's step 3. And we had a lot of, I think, robust discussion about how sometimes even in the best intentions to develop resources, they're not always well utilized in terms of how, their impact on families needing them. And so I think some of the discussion we were having in terms of practical was trying to develop things as close to the family as possible and put the control sort of in their laps, and really finding ways to help them develop the natural supports where they could find sort of their own respite options within their support groups that they might find most useful, rather than envisioning other systems, which we had discussions just that access sometimes can be really, really difficult. Each program has narrow criterion. The timing may not always work. There's a number of factors that get in the way for effective usage. And we talked about some of the respite programs that really are sometimes not very well utilized, even though that's not our best intentions. So I don't know if Christiana wanted to add anything else to that.
Sure, I'll add a little more. So in looking at the definition, when it talks about drop-in childcare, Relief Nursery often requires folks to register in advance, and so it doesn't technically operate like a drop-in program. So we discussed perhaps dropping the Relief Nursery part out of the definition. And then the other thing we discussed is like in-home and out-of-home respite options, because not everybody will be comfortable having somebody in their home versus some people may not be able to go out of their home for respite because they need to rely on the things in their home. So those were some other additions that we had to the definition. And then if you were to broaden the definition of respite to include the youth, then in at least the IHN area, we noticed that Jackson Street Youth Shelter was not on the list in the mapping, but we also talked about if it's not a place that youth want to access, then we can't really consider it necessarily a respite provider. And so that goes back to that being culturally responsive and flexible and having a variety of options.
Awesome, thank you. Yeah, I will definitely put on the Jackson Street Youth Shelter. Do you know if that is a shelter program that kids can, like, who aren't currently experiencing homelessness can go to, or is it only for kids that are on the streets actively?
Yeah, so they do have a CCO contract, and so
They do. Okay,
they do.
perfect. Group 3. Yes, I don't know.
Amanda, Liberty, and Megan.
Okay. Hi, everybody. I'm going to be sharing out for our group. So just a couple of things that we noted where we really liked the that first definition for system of care, except we wanted to take out complex behavioral health conditions because respite is needed for other reasons as well. And maybe adding from that second definition that respite care can be pre-planned or provided as crisis support. So that kind of covers those services that do have that pre-planning bit, and also services where you need crisis support in that moment. We thought the third definition for IDD is way too specific to be used in a general definition of respite, but it's good for what it is for. And then we also talked about the need for a disclaimer. So not having examples of what respite is in the definition of respite, but having a list of scenarios available to help people figure out if it's right for them. So building criteria maybe based on those recommendations, or noting that criteria for different services are variable. And we need to have the clarification there on individual agency guidelines like age limits, the reach into different areas and overlapping areas for different programs, and then also lengths of stay and what that looks like for each one. And as far as on the map, something that we said could be added was safe families for children. I think it might be overarching. Liberty, if you could touch on that maybe, but it's in Douglas County.
It is actually an international program, so it is throughout the United States, Canada, Hong Kong, Australia, and the UK.
Thank you for that clarification, Liberty.
You bet.
Yeah, thank you so much for those recommendations. Those are all really great. And like having especially a list of different things for the people to like understand what each thing is really important. With the safe families, it is on there in the informal supports. It's in like safe families model. It's like very small, but the reason that we kind of haven't put it is because it seems like each area has its own kind of model within the safe families. Seems like some areas are like very faith-based safe families programs where others aren't. And so it seems to have a lot of variation. So like also if anyone knows anything more about like as a state or things like that, that would be great. But it just seems like all the different chapters are so vast from each other that it's kind of hard to put as like one model because they're all kind of different models, it seems.
That's good feedback to hear because technically they should be I mean, there's going to be some variation because we are volunteer based and different chapters have different levels and variety of volunteers, but requirements and types of support should be consistent.
Okay, that's really good to know. Yeah. And maybe we can connect later, Liberty, to kind of talk more about what that looks like throughout Oregon. That would be great to do some follow-up.
Absolutely. I would love that.
Awesome. Thank you so much. Cool. Christy, if you want to say group 4.
Ramona,
Yes,
would it
Dad.
be possible to take down the screen so we can see one another?
Absolutely.
Lovely.
I just,
Thank
yep.
you. I know.
I was thinking for like
easy done.
directions.
Yeah.
So, okay.
Is that my group, Christy? 4? You're muted, friend.
Katie, Haley, Pamela, and Sharon. Yep, room 4.
Cool. I'm enjoying this conversation so much. Maybe it's because I've been living, eating, and breathing respite for the past year or so in this role. And I'm learning loads. I am not an expert in this by any means. So our reaction to the definition, which I want to commend anyone for trying to make a definition for respite because it's really, really hard. And here in Lane County, we're like, it's a break. That's how we put it, just plain and simply, it's a break. And so we found our group, Amazing Humans. We thought that the current definition specifically for the one SOCAC definition, that it creates silos, right? It creates silos by having a definition that only encompasses behavioral health, which we know that the system of care model, framework, philosophy, everything, right? The backbone is that behavioral health kind of piece. And yet I think several of our systems of care are not leaning so heavily into that being like the criteria for participation and kind of barriers and things. So we were wondering if it was possible that the SOCAC's definition could encompass all systems, right? Or be a definition that would, you know, expand to multi-system involvement. And those are hard, not very friendly words, multi-system, complex needs. But Ramona, I sent you a couple of just snippets of what we discussed. And then we didn't even look at the child welfare and the host home definitions because it kind of tied into that conversation about there being these individual silos. And we were talking about how one of the unofficial goals and values of the SOC is to stop having the that's not our kid or that's not our family mentality. We want it all to be all of our kids and all of our families. And so it would be really helpful to have a definition of respite that could encompass that kind of belief. And then as far as what's missing from the mind map, we have a list and it ranges from some kind of statewide supports that exist. For example, shout out to Sharon for reminding us about the Autism Society of Oregon that provides funds for kind of family and parents night outs, which is really, really cool. They're very generous with their funds per Sharon. And then we had just a couple of more specific ones and some ones that like we count as respite in Lane County, right? But like, you know, are they? I don't know. I guess it depends on the definition, but we're counting them. So I have emailed those to you, Ramona.
Awesome. Thank you so much. Yeah, the map is already chaotic, so anything we can add is just going to add to the chaos. It's going to be great. So anything and everything. Group 5.
Group 5 was Carissa, Gabe, and Jordan.
Hi, it's Carissa. We didn't decide on someone to report out. I think it'd be nice to hear from all of us. Definitely. I know Gabe was kind of in transit, but he had some really great points. When it comes to the definition, I don't know how, like we tried to come back to that, but there were just other conversations around wanting to get more upstream. And like, yeah, similar to a lot of what has already been said, like, does crisis need to be part of that? Does the complex behavioral health issues have to be part of it? And that's what, I mean, I just put in the chat, like, less is more, which oftentimes I think it really is. And I just came from a health related service needs or social needs meeting about Medicaid. So, and again, I'm just like, the good thing is we're involving people with lived experience, so that's great. But I think, what is the goal? The goal is to not have barriers. The goal is to provide this service, right? And so I just think sometimes it can get too convoluted with when we're trying to be inclusive, but then it becomes exclusive, because then it's like, well, I don't see me on there, so I don't know, or like, it's just like too much. So I think if we could simplify it in some way, keep, less is more, like, that might be helpful. And I think, something Gabe said, which I think is really great, is to have this as, more preventative, not only for these families. Of course, that's the thing. We have to meet these high needs situations. And obviously it's part of this system of care. But what about like kids who are in families, before they end up in the foster care system? And if there's some way to leverage the systems that are already touching those children, sorry, that sounds terrible, but touching the lives of those families and children, are in those communities already available, whether it's a nonprofit or a state program or local program, at a local health department, finding what's already there. It sounds like, and I don't know if this has happened, but like a really good environmental scan would be helpful, and creating those opportunities for children who are, yes, in the system, but also children that are not yet in the system. Just having more wraparound and safety net in the communities across the state. And Gabe and Jordan, please, if you can, share your thoughts.
Hi, everybody. I hope you can hear me. Sorry for the red noise. I really love that last statement that was just calling it a break. And I think really focusing on strength-based language in the definition to identify that every parent needs a break, and kind of trying to normalize that rather than stigmatizing. I think sometimes respite has this very systems connotation to it that maybe drives some people away from thinking that doesn't apply to them.
Absolutely.
Yeah, I love that. Especially, I think, there's an opportunity here to address the like the narrative and the societal problem we have of just we're not very good about taking care of each other and like supporting each other, right? And like supporting our community. So yes, really appreciate that. Thank you, Gabe.
One thing to touch on what Chris was saying too is seeing respite not only as like after things have already happened, like after kids are already in the system, but using it as kind of a prevention tool. So framing it as both like anything and everything, I guess, when it comes to helping, and and the like people getting support in any way they need support is definitely something that's really important.
Yeah, I don't want to take credit for that. That was totally all Gabe, and he has great lived experience and professional experience that he, is bringing to the table. And I mean, I can just say though too, with my own, I grew up with a single mom, and she had to work 2 jobs. We were on our own, and probably could have very easily ended up in foster care, like if someone found out about that, and and just having that supportive environment for all youth and children in our communities. We know that it does exist across the state here and there, and just being able to find out where that's happening, and if we can get funds to those organizations or develop more organizations doing that. And again, yeah, that helps remove the stigma because it's for all children. It's great. And so yeah, thank you, Gabe, for sharing that, and just want to give credit where it's due.
Not to like just belabor the point, but someone had mentioned something earlier about just pointing towards positive. And so respite, when we talk about respite, we talk about it as a break from rather than a break to. And so thinking about like, here's an opportunity to expand a child's sense of community and love and support. And just finding a way to build that in the definition could have larger impacts down the road, kind of what we're trying to build out. If we're looking at, universal respite childcare help. I don't know what we're going to call it as the end goal. Personally, I am disclosure. I'd love to see that. So I don't know. Just thinking of it in more of the positive terms. Yeah.
Exactly, and celebrating also like what already exists in the state and like all the work that people are doing also is really important. I don't know if that was the definition, but yeah, I really like the opportunity to to do things and not. I love that.
All right, last room was Christy, Danielle, Marsha, and Selby.
Well, I took notes, thinking maybe I'm the reporter outer. In terms of the respite definition, we just looked at the first definition, the primary one. And again, being the last group, we had 4 bullet points under observations for that definition, but I think they've been mentioned previously in the conversation and have been accounted for, so I won't repeat. In terms of the mind map, we do have some suggestions of things we saw that we thought were missing. There were 2 suggestions of new terminology that might be kind of interesting, that a better term for babysitters would be informal childcare, and that a better term for daycare would simply be formal childcare. In other words, how the terminology kind of impacts how we view or consider those services. And then maybe kind of the general overall comment I might make, reflected slightly in some things other people said, is just the kind of the concept of relief nurseries and understanding of their services, that the way they're portrayed in the definition and perhaps even a little bit on the map doesn't really seem to fit with how how a relief nursery may self-define their services and view what they're providing. So just kind of making clarity from relief nursery professionals about how they view their services and how those would fit in there. So, and then I would invite other group members to please add any other comments.
Hey, this is Marcia from Family Development Center here in Douglas County. I would just add that I agree so much with, I think, group 6 before us said, how we just perceive things and come from a strength-based perspective and just normalize that parenting is tough across the board. It doesn't matter who you are. And so all families need a break. All children need a break. So I really like the way that was presented, and same thoughts.
Actually, Marcia, Chrissy just put a question in the chat, but I think you could actually respond to it better about, or would relief nurseries be considered more of a formal support? I guess, Chrissy, as opposed to informal, or?
So I would definitely say we are probably more of a formal support. It's a very structured process. Families are getting multiple layers of support, and respite's just one piece of it. And it isn't a drop-in basis. It's specific to a day and a time, and we have the same quality TECP classroom teachers structuring that. So I would say it's a very formal support.
Great, thank you.
But I'm one person, so.
If I may, here in Lane County, the way that we were putting these in different groups for just Lane County was planned versus unplanned, right? So that's just another potential for rather than formal or informal.
Absolutely. Marcia, I would love to chat more about that, so I will reach out after this meeting. But for the sake of time, it's almost 4:30, so just kind of moving on to kind of next steps, and like just so you guys know what we're looking at over here. We are going to be continuing to explore, of course, a lot more. Here, I'll share my screen real quick. Okay. Come on. Okay, so we've convened a work group with a bunch of different system of care partners, and we'll probably be reaching out to some of you in the near future to see if you would like to join us for a meeting and that kind of thing. We're also doing some work in the state agency standing committee related to respite. I am going to be continuing to build out this environmental mind mapping of everything respite related to the state. I'm also going to be scanning other state delivery models. We have some technical assistance from the University of Connecticut. And so they've sent me some people I should connect with in different states. So looking at just how statewide systems of respite are developed and like what that looks like, not just community-based, which it is very community-based, if there's like a larger network that can be developed. I'm currently working on gaining youth and family information about like qualitative data about experiences with respite or working on building out recommendations. We're going to be investigating funding mechanisms for overcoming workforce challenges with related to respite in the state, exploring trial respite practices, meeting with some people that work with these tribes, and also developing policy recommendations around respite for the state. So that is kind of the next steps. Feel free to reach out. My email is right here. It's been posted everywhere, but thank you so much for taking the time with us, and have a great rest of your Tuesday.
You too, Ramona. Thank you. Thanks, everybody.
Thank
you.
you. Great job, Ramona. Thanks.